Describe this sensation to me.
It's in the back of the neck, just like feels like I need to not pop, but like kind of stretching the muscle a little bit. Just you got to make not kind of like make it tingle a little bit, a little pain or something.
Okay, and in addition to the jerking, what else do you do with your neck?
Just twist it.
And could you describe what sort of problems you're having?
I'm having trouble with my eyes, keeping them open, and my face, getting contortions, and then my neck.
This 51-year-old woman was previously treated with haloperidol and thyroidazine for psychotic symptoms. She developed blepharospasm, which gradually evolved into more severe cranial cervical tardive dystonia. This 76-year-old woman has a 2-year history of tardive orofacial stereotypies related to an 8-year treatment of chronic nausea with phenothiazines.
How old are you?
77.
And what is it that's bothering you the most?
My mouth.
How long have you had the problems with your mouth?
Well, I guess about a year and a half.
How long?
About a year and a half.
Okay.
This 82-year-old woman with Alzheimer's disease was previously treated with haloperidol and recently developed complex touching and rubbing tardive stereotypy and akathisia. This 15-year-old boy with a 10-year history of attention deficit followed by obsessive-compulsive disorder has a 6-year history of severe complex motor tics manifested by falling and rolling as well as complex finger and hand stereotypies. This 77-year-old woman with cortical-basal ganglionic degeneration began to lose the use of her left hand 5 years ago. She subsequently developed contracture of the left hand, marked apraxia of eyelid opening, postural right hand myoclonus, and severe gait and postural impairment.
Could you put your arms in front of you, hold them up? Just spread your fingers apart. At this point, what is it that's bothering you the most?
There's a full range range from shouting, involuntary shouting, whether it be in a doctor's office or a bus or office. There's the head shaking, there's pain.
This 15-year-old boy with severe capillaria as part of his Tourette syndrome failed to improve with conventional pharmacologic therapy.
Okay, just that.
Welcome to my house! Jam, stop!
This home video of a 10-year-old girl with a 2-year history of Tourette syndrome demonstrates disabling complex motor and phonic tics. The noise is generated by the patient and her affected siblings.
Okay, you are now 20. Yeah, 28 weeks pregnant.
Yeah.
And what has happened during your pregnancy as far as your tics are concerned?
Like it, nothing really. No, it just got worse a little bit.
Mhm.
Yeah. Right. Oh no. Yeah, no, this. Oh, this. Yeah, this.
I feel like that a lot. Said it's so. Not.
So you have a hematoma there. Yeah.
Yes, sir, and I don't like it.
Yeah. Can you take the hand off?
Sir? Sir? Sorry.
This 75-year-old woman with a 10-year history of disabling essential tremor, unresponsive to pharmacologic therapy, required treatment with deep brain stimulation involving implantation of a stimulating electrode in the left thalamus. The video segment recorded before the stimulator is turned on shows the coarse and disabling tremor in both hands. This is a 31-year-old woman with history of tremor in both hands since age 7 years. She later developed writer's cramp and tilting of her head to the right. The video segment shows the postural tremor with characteristics of essential tremor, hand dystonia, and dystonic head tremor. This 77-year-old woman presented with a 2-month history of left hemiballism following an acute infarction in the right subthalamic nucleus. This 84-year-old diabetic woman had an acute onset of right hemiballism secondary to an acute infarction of the left subthalamic nucleus. With the institution of tetrabenazine, the hemiballism markedly improved.